Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Russell Kohl. He is a family physician and the Chief Medical Officer of TMF Health Quality Institute. Dr. Kohl, thanks so much for being here.
Thanks for inviting me, Robin. I'm looking forward to it.
So we're talking about TMF's work and the 13 scopes of work. For viewers who may not know, what does that mean and why is it important for Arkansas?
Sure. So Medicare has a program called the Quality Innovation Network Quality Improvement Organization Program, or QINQIO. That program is generally a 3 to 5 year contract where they focus on quality improvement across anyone who bills Medicare. In the 13th scope, this is the 13th time they have done it. And so that's what the 13th scope of work actually means, is that it's the 13th iteration of the QINQIO program.
And what are the top healthcare priorities TMF is focusing on in Arkansas under that 13th scope of work?
Sure. I think it's important to recognize that this is a free program to any healthcare provider who does bill Medicare. So across the state, this is a program that, it's no cost. It's focused on quality improvement. And how do we make measurable improvements? And so as you ask, what are the top priorities? Well, certainly as CMS put funding towards it, or Medicare. So the way that they really want to focus those on is really making sure that we're working particularly with rural and small providers, that we're looking at the workforce. So not just the physicians, not just the burnout that may be associated with particular jobs, but looking at the entirety of healthcare, the medical assistants that work in nursing homes, the nurses that make the hospitals work. How do we bring that whole workforce perspective into it? And then how do we really use the data to improve quality? We collect lots of information, but are we actually turning it into something that helps us make a better decision of how to take care of folks?
And using that data is a part of the partnership that with Arkansas providers and organizations like AFMC that help drive improvement on the ground?
Absolutely.
And what measurable improvements do you hope Arkansas patients, families, even healthcare practitioners will see over the next few years?
Really what we're looking for is, in the grand scheme of things, better outcomes from better care in better systems. And that really is how we focus everything. We look at things like diabetes, heart disease, making sure that we're identifying folks as early as possible, that those folks are getting the right care, that we're actually monitoring it and seeing that it improves. If your doctor gives you a medicine, but it takes 9 months for it to make things better, well, what if we could have made that better in 3 months by recognizing it's not working, making an adjustment, and getting your medications corrected that way? From the patient perspective, we want to make sure that you go to the emergency department when it's an emergency. A lot of folks end up in the emergency department because they don't have access to care. That's one of the things that we really want to focus on, is making sure that you have access to the right level of care at the right time and making it feel like your care is actually coordinated and reliable, that you don't have to know a secret handshake to have the continuity of care that folks actually really want to have.
And Arkansas is such a rural state, and there are so many rural health challenges. How does this help support small and rural hospitals and even clinics?
Yeah. I started off in rural Oklahoma in a practice there with a hospital of 22 beds. So I understand the idea of small practices and small hospitals. One of the things I think is really important about this particular program for Medicare is that it really focuses on making practical changes that fit a real world workflow. This isn't someone in DC has drawn out a picture on a chalkboard and said, oh, you should do it this way. This is local technical assistance. This is folks who live in Arkansas, who know the healthcare community, who are able to go in and sit down with a practice and say, okay, what actually works here? What's different about your community? The community that I practiced in had a lot of cattle ranching and horse farms. that's a different type of patient coming in than, Western Oklahoma, where I would have had wheat ranchers. And so recognizing and understanding those and making sure that the assistance that we give folks is tailored to the type of practice they actually have.
And TMF recently announced partnerships with organizations like the Institute for Healthcare Improvement and Arrow ARC. How will these partnerships benefit Arkansas providers?
Well, we certainly don't like to reinvent the wheel. And so, the IHI is an internationally known agency that does a great job of providing that really solid basic education for folks about, if I'm interested in improving healthcare, what are the things that I need to know? Certainly we could rebuild those, or a better idea is we can make a partnership with them that allows us to link folks together. And so the hospitals that are participating with us, the nursing homes, the physician offices, they'll have free access to all of IHI's training programs. So they have a quality improvement course that they offer online that is roughly equivalent to a master's degree in quality improvement. That's something that a lot of times small practices don't have the money to send somebody to, but we're able to make that available to them through the program at no cost whatsoever. Arrow Arc, on the other hand, so they're a group that has a long history of working, particularly with the Veterans Health Administration, around staffing for their facilities, for their hospitals, for their nursing home programs. As we've worked with folks, staffing is a huge issue. You can't talk about how you're going to affect healthcare quality if you can't have the staff to actually pull those things off. And so ArrowArc, bringing in their decades of experience in helping deal with the practical aspects of, where do I find folks? How do I make sure that they're trained? How do I avoid having turnover as different jobs come open in the community? All those sorts of things. Having those sorts of resources that isn't something that traditionally folks have had access to, we think is really a value add for the practices.
And what lessons from Arkansas and programs could become models for improving healthcare access across the nation?
I think the first one is to recognize that a rural state can absolutely still be in the lead on practical quality improvement. A lot of times when people talk about quality of care, they want to talk about, the Mayo Clinics or Massachusetts General. Well, you can have those same sorts of experiences in a rural state like Arkansas. And the reason we can do that is because of the community and those strong local partnerships. It's not a situation where one hospital center just takes off running. The way we are organized for the Queen QIO program recognizes, where do the patients who live in a community, where do they go for their primary care? Who does that primary care doctor deal with when that person needs to see a specialist? Where do they go to the hospital? Where do they go to the emergency department? And if that's not something that smaller hospital can deal with, who do they refer to? And so really taking that community-based holistic approach is, core to what healthcare has looked like for generations in Arkansas. And I think that's a lesson that spreads well across the country.
And you touched on chronic diseases and illnesses a little bit. How do these initiatives help improve prevention and long-term management?
Yeah, there really are two ways that we look at that. One of those is the data aspect. Like I said earlier, sometimes you have a whole lot of information in an electronic health record that may not actually get looked at or used to generate reports about, hey, who needs what? How can we do things? Sometimes physician offices are so busy trying to deal with the problem in front of them that they don't get to think about the problems down the road. One of the things that we're really focused on is automating that process in a way that makes it easy, so that when you go to the doctor, it doesn't take extra work for your physician or your nurse practitioner or whoever you're seeing that day to recognize, oh, okay, here's what you're here for today. But, we can take care of something that you were going to need in a couple of weeks. Let's get that knocked out today for you too. So that's the data aspect of it. And then the care aspect of it is just making sure, as medicine changes incredibly rapidly, and AI has not done anything to slow down that change, the ability to help physician practices, hospitals, and nursing homes really figure out, how do we integrate that into our care so that we can make sure that, maybe there was a new medication that I didn't learn about, but would be perfect in this particular patient situation. How do we make sure that those things are available and they're able to see them? The days of waiting until the New England Journal of Medicine gets published to know what has changed in medicine is kind of a thing of the past. And so we're trying to make it to where you can keep up with those things, but still have the ability to, as a physician, see your kid play baseball one evening or actually have dinner with your family and not have to be sitting under a pile of medical journals just trying to keep up.
So the interoperability in healthcare information exchange really plays a huge role in this work.
Oh, yeah. Yeah, entirely. It's rare for somebody to get all of their care at one place. And so just as you move through a healthcare system and move through different settings, it's really important that your data makes it there too. And that's one of the key aspects of that interoperability aspect is if you're seeing at a specialist, well, your family doc ought to know what they did or what they're thinking. If you end up in the hospitalist and maybe your family doc isn't the one who's taking care of you there, I promise they know things about you that the person who's taking care of you in the hospital would be really useful to know. Making sure that we have that sharing of information, not because we're just trying to move data from point A to point B, but because we're trying to make the best care of a patient.
And how are you incorporating health equity into quality improvement efforts?
Well, I think it's important to recognize that when we're talking about health equity is just trying to identify who is the current system not really working for. That may be geography. It may be that you're 60 miles from the nearest facility. It may be that you don't have a car that will, make it over the mountain to the next valley, which is where the hospital is. Maybe it's language, technology. One of the issues that we run across a lot across our region is internet access and internet speeds. These are all health equity issues. We want to make sure that folks are able to get the best care regardless of which of those situations are. So by focusing on those local barriers, and it's not an abstract, we want this to be something better. It's looking what in this community is making it not work for some people, and how do we make sure that we can fix that?
So looking back 5 years from now, what differences do you hope that not only patients, but healthcare providers will notice in the care that they give and that they receive?
I think this is one of those situations where we want the future to look a lot more like we think the past used to. And what I mean by that is we either imagine or remember a time when your doctor actually knew what was going on around your whole life, that the care was connected when you went from place to place, that there weren't dropped handoffs, that if you left the hospital, your doctor knew why you had been there and what needed to be done, and you didn't feel like you had to be the sole person getting you through the healthcare system. 5 years from now, what we hope is that we will be a little bit closer back to that idea by being able to make sure that the information moves, that the data about you is actually being used to help improve your care. I think that's the things that we're looking for on the patient side. And I think that by building those things in a way that isn't just admin burden, we're able to help the physicians get home in the evening, see their family, have dinner, not be as worried about staring at a computer throughout a visit, being able to put a hand on a shoulder, talk to a patient, and actually give them the care that they need, not just the medical interventions that they need.
Well, Dr. Kohl, thank you so much for talking about this important work that you're doing and for all of the work that you're doing to improve the health care of not only Arkansans, but across the country. Thank you for being here today.
Thank you very much. I appreciate it. AFMC has been a great partner for years, and we really appreciate the great work that you're doing in Arkansas and continue to a long and happy relationship, helping folks across the region get better care. Thanks.
Thank you. And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.